Did you miss an Ozempic or Mounjaro dose? The safe answer depends on the clock, not on hunger or panic. Ozempic gives you 5 days, while Mounjaro gives you 4 days, or 96 hours. Outside that window, skip it rather than chasing the weak. A late dose can be safe, but never double up with extra medication to rescue the schedule. Ozempic, the brand name for semaglutide, and Mounjaro, the brand name for tirzepatide, remain in the body for days. Their levels fall gradually, rather than disappearing between injections. That slow decline is why one missed injection does not erase the medicine overnight. It also explains why doses taken too close together can overlap. Exact timing matters more than how the medicine feels. Sleep, stress, meals, activity, and routine can raise hunger before the drug has fully cleared. That can feel like the medicine stopped working even when it has not. Use the dosing rules, not appetite, to decide whether to inject. The Ozempic missed dose window lasts 5 full days. If 5 days or fewer have passed since the scheduled dose, take it when you remember, then return to your usual weekly day. If more than 5 days have passed, skip the forgotten dose. Take the next injection on the regular day. A 5-day window works like this in practice. A Monday morning dose remembered Thursday morning is still inside the window. Take it Thursday, then return to Monday. A Monday morning dose remembered Sunday afternoon is more than 5 days late. Skip it and wait for the next scheduled Monday. The calendar can make that Sunday dose look harmless. Sunday and Monday have different names, but the injections would be less than 1 day apart. Taking both would put 2 weekly doses too close together. The missed dose rule does not tell you to recover lost time. Ozempic also has a separate rule for changing the weekly injection day. When changing the day, leave more than 48 hours between the last injection and the next one. That spacing rule does not extend the 5-day missed dose window. Mounjaro uses a shorter 4-day late dose window. Take the missed injection within 4 days or 96 hours after the scheduled time. If more than 96 hours have passed, skip it. After skipping it, resume on the normal weekly day. If your Mounjaro day is Monday evening, Friday evening marks the full 96-hour window. That is the last point when the missed dose can be taken. After Friday evening, skip it and wait for the next scheduled Monday. The next scheduled dose matters just as much. At least 72 hours must separate a late Mounjaro dose from the next dose. The same minimum applies when you deliberately change your weekly injection day. A Friday evening late dose can be followed by the regular Monday evening dose because exactly 72 hours have passed. Any later dose would sit too close to Monday evening. Trying to fix a missed week can be more dangerous than accepting it. Extra medication may increase nausea, vomiting, diarrhea, or stomach pain. Skipping one dose can feel like failure, but doubling creates a new problem. More is not safer. If your week is hectic, record exact times. Monday is less useful than Monday at 8 p.m. Near a cutoff, several hours can change the answer. The clock prevents a late dose from becoming an accidental double dose. 2 people can miss the same Monday Mounjaro dose and need different actions. One remembers Wednesday and remains inside the 96-hour window. The other remembers Saturday and must skip it. The medication is the same, but how much time has passed changes what you should do. A missed dose does not change the amount prescribed for your next injection. Use only your current prescribed dose unless your prescriber changes it. Hunger or a slower week on the scale is not a reason to move up early. Using more medicine is not the only way people try to compensate. Do not make up for the missed dose by barely eating. Severe restriction can leave you weak, dehydrated, and more likely to overeat later. Return to your usual structured meals, fluids, and protein. Not every missed dose comes from forgetting. Travel, refill delays, and damaged pens can cause the same problem. The reason for the delay does not change the clock. A replacement pen does not create a new window. Always count from the original scheduled injection time. If you are not sure whether you injected, stop before using another dose, check your medication log, calendar, reminder app, or injection tracker. When the answer remains uncertain, contact your pharmacist or prescriber. Guessing can create an unintended extra dose. 4 facts should guide every late dose decision. Identify the drug, the scheduled time, the current time, and the next planned injection. Those 4 facts determine whether the late dose can still be taken. Symptoms, appetite, and the scale cannot replace that calculation. The injection decision is only half the problem for people with type 2 diabetes. Blood sugar may rise after a missed dose, especially after meals. Follow the glucose plan already given to you. Do not invent extra doses of insulin or other diabetes medicine. If you use insulin, this matters. A sulfonylurea is a pill that pushes the pancreas to release insulin. Either treatment can increase low blood sugar risk when combined with these weekly medicines. A missed weekly injection does not tell you to change your insulin or sulfonylurea dose. Do not stop basal insulin, the background insulin your body needs, because Ozempic or Mounjaro was missed. Check glucose according to your established plan. Use only the extra insulin doses already written in your diabetes plan. Treat severe low blood sugar as an emergency. Low blood sugar is not the only urgent risk. Repeated high readings with vomiting, dehydration, or ketones need urgent medical care because high ketones can lead to diabetic ketoacidosis, a life-threatening emergency. Ketones can build up when the body lacks usable insulin. Extra weekly injections will not correct that problem. After a dosing error, seek urgent help for repeated vomiting, fainting, confusion, severe stomach pain, or inability to drink. When no urgent symptoms are present, the next question is how long you have gone without the weekly dose. One missed dose is different from missing several weeks. The product instructions explain one missed injection. They do not give one universal restart dose after a long interruption. If several weekly doses were missed, contact the prescriber before restarting. Give the last dose strength, the last injection date, and previous side effects. Those details help determine whether to resume the same dose or restart at a lower dose and increase gradually. Previous side effects help guide that restart decision. Strong nausea, vomiting, or not being able to drink enough fluids may lead your prescriber to restart you at a lower dose. Restarting the old high dose without a plan can make eating and drinking difficult again. Preventing the next missed dose is simpler than repairing one. Use a repeating phone alert with the drug name and dose. Mark the injection immediately after taking it. During travel, record the time zone and the exact time of the last injection. If a caregiver helps, use one shared injection log. Ozempic allows a late dose within 5 days. Mounjaro allows a late dose within 96 hours. Keep the required time between doses, never double up, and contact your prescriber before restarting after several missed weeks. Follow the clock instead of reacting to panic. Medicine simplified, that's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.